Good day, everyone. In this video, we are going to continue the last session of the listening and smelling. We're going to talk about the smelling odors. In this session, although we can see lots of information in the slides or from your textbook, the explanation is correct, but sometimes it is not practical. So we only focus on some of the information here. The reason why you will see afterwards. Why some explanation or is not practical because it's not convenient. For the smelling odors, we mostly focus on some kinds of smelling that can indicate excess heat or coldness. So firstly, the odors from the mouth. This one sometimes we can feel that, especially during the consultation. That's mostly because the backs of out breath when people speak. So this is something sometimes we can, although it's unpleasant, but sometimes we can experience a foul breath, foul breath coupled with stomach distension that indicates food retention. Fishing, fishing stench. What does it mean by fishing stench? So this kind of smelling is something when you go to the supermarket, you go to the section where they sell fish, that kind of smell. That's the fishing stench. So this can indicate the coldness if without coughing. So with the coughing, it can be the lung problem, but if without coughing, it can indicate the cold condition of the body, such as in the urethra. Smelling in the nose and nasal discharges is something we can ask the patient. The odors from the sweat and the phlegm, that something is unpractical. No, because it's really inconvenient to have this kind of smell. But you just can go through by yourself, and then you can keep in mind that if you have a chance, or if the patient tell you there's some funny smell from their sweat or from the phlegm, then you will know that this can help us to identify the symptoms. The odors from the vomiters is also inconvenience from the practitioner's side, but probably the patient will know the smell, so you can ask. The odors from excretion. From the excretion, mostly from urine, stool, and for ladies, include the leukorrhea. The leukorrhea, especially for leukorrhea, if the damp heat will have a strong odor, mild odor, or the fishing stench. That's the coldness. So that's something we can ask. The information from the smelling odors is not a main content in this session. The reason is, as you can see from this introduction, some of them are just not practical. You cannot perform in the clinics. So you can just keep in mind that in general that we can use the theories to differentiate if you have the chance. The last session, the odors related to the wards. So in some conditions, you can smell some kinds of smelling in the wards or in the bedroom of the patient. This just in general, you can keep in mind in some very special smelling, such as the smell of urine. So that kind of smelling in the wards often indicates patient with kidney failure. The smell of rotten apple, also in the wards, you can see in the diabetes It's not even the later stage, it's actually severe condition of the diabetes. Garlic indicates poisoning. So these just some of the smelling that you can keep in mind. Okay, so these are all the information in listening and smelling. So now we have introduced the inspection, inquiry, and listening and smelling in our practice. We're going to combine them because even from the listening, we can hear the voice from the patient. From the smelling, when we talk to the patient, we also can smell if there's some abnormal odors from the patient's side. So these diagnostic methods, sometimes they happen together. So it doesn't work one by one. We also talk to the patient, and then the next step, you tell the patient, let's start the listening. And then after the listening, you will say, let's start the smelling. So that's not the way. The way is during the consultation, we're going to combine all these diagnostic methods in the inquiry. During your inspection, if there's some odors, you will pick up from you will pick up while you perform the inspection. If it's the patient's voice or sounds is abnormal, you also can pick up from the consultation during the conversation. So these diagnostic methods, we're going to combine them together. And in the next video, we're going to start the pulse diagnosis. Thank you, guys.